exclusive interview with the prestigious Mayo Clinic General Surgery Program Director. Make sure to stick until the end of this video because I will be sharing with you 2 free guides that will help you ace your residency interview. What do you look for in surgery applicants for both Americans and international graduates? When you look at all these applications, what factors do you look at to decide, okay, we're interviewing that versus this?
Okay, that's a very complex question, and I'll try to go through each part of it, okay? So every program will have a series of, we call it filters, or kind of how to go from a big number of applications to the smaller number of applications that will be the actual interviews and eventually the ranking and then matching, okay? So both for categorical and international medical graduates or preliminary positions, everybody that applies at Mayo Clinic, we look at both objective and subjective data, okay? Before I start talking about this, I just want to make a few important points about our application process. First of all, we look into everybody, right? Every application is looked at. We do not consider any preliminary residents that are currently in the United States doing a preliminary residency within general surgery. Why do we do that? Because we do have, right now this year, we have 10 preliminary residents. And if we're going to consider anybody for those potential categorical positions, we're going to consider our own. And that's been a tradition within Mayo. I think we own it to our current preliminary residents. And I know it's unfortunate. I would say we have a good number of applicants that are currently preliminary residents. I just want to be very clear that those applications we look at, but we do inactivate quickly because we give it a priority to our own preliminary residents. Then we go through, we have a due date, right? Every program has their own due date. ERAS has a due date, but we have our own due date. And the reason we have our due date is because there's so many applications. This year we had, and years prior, we've been having 1,700, 1,800 applications. So at some point we need to stop and actually look at the applications. So think when you're applying, think about having all of your documents, all of your letters, everything ready early, right? Early within the first days of applications. And the other thing will be keep an eye on each program you're applying because that due date might be very different from program to program. And again, there's the ERAS date and then there's the program date. So a little bit of tips and tricks already there to think about. So those are kind of our big filters. Other than that, as I mentioned, we look at every application. So what are we looking for? That's what was your question. Well, we're looking for the stars. We're looking for the best applicants. How do we define best applicants? Well, we know that that's when we include the objective data. What is the objective data? Well, your grades at the school. Don't matter where you did medical school, you're gonna either have a pass or fail, or you're going to have an A+ or an honors, right? We do acknowledge that every school is a little bit different in how they grade their grading system. If it's a pass or fail, then we're going to look at that dean's letter. We're going to look for words like that's outstanding and evaluations that are, people that are unique and out of the ordinary. That's what we're looking for. So that's one of that objective data. USMLE, obviously, everybody will always look, if there's a standardized test, we look at the standardized test. This year, we didn't look at all at the step 1 because it's a pass or fail. So we look at everybody that pass at least as a second take. So if you didn't pass your USMLE 1 or USMLE 2 the first time, we're still going to look at you and we're going to look at that grade. Because we do believe that people can, make a mistake and do better later. Sure, why not? We all can be like that. So that's another thing we take in consideration. We don't have a specific number that we use as a filter. We go through good grades, honors, we go for the highest grades, and then those who have a few honors, then we look at that USMLE. Okay, and based on our own data, our average USMLE from the applicant pool, it's about a 250, 260, depending on the year you look at. So we go a little bit lower, so we look at that 240s. But again, if you had honors, I'm not gonna even look at your USMLE. We're gonna go directly into our interview pool. So that's kind of the most objective data that we have, the most objective data that we have, it's going to be your letters of recommendations, your personal statement. So letter of recommendations, what I'm looking for the stars again. It's the same concept. Those are top in their class. Those are extraordinary human beings, extraordinary medical students that did what they had to and above, right? That they already have strong values and characters. That's what we're looking for. Very important to mention that we're looking for letters of recommendation for clinicians, right? You as a clinician, as a student, maybe it's a student, or maybe you already graduated and you work in a hospital, and they know you as a clinician. That's the letter of recommendation that we're looking for. Research letters are great. They tell me a lot about it, but we are hiring for clinicians, and you can be a fantastic researcher and maybe not that good as a clinician, or vice versa, right? But this is a position, the residency is a clinical position. So I would highly suggest that everybody have at least one, but 2 letters of clinical experience, somebody that have seen you as a clinician. Okay, so that's another thing that we look at. Personal statement. What am I looking for? I'm looking for people that have a purpose, they are very clear on their why. Residency is a part of your life. It's not your life, right? It's going to be, actually, it might not feel that way right now when you're applying, but on the big scheme, it's a very sure part of your life. The big part of your life is going to be your profession, what you're going to do afterwards. So who are you? Put your soul into that personal statement. Don't tell me what I want to hear, what you think I want to hear. I want to read a personal statement that inspires me, that shows me who you are as a person and as a human being. I already know how amazing you are as a professional. I read your CV. I know your grades, right? I already know so much about you. So I want that personal statement to be a reflection of who you are. And we are looking for people that can add to our program, right? That can bring new ideas, that can that can thrive, obviously, within our system, but that can make our system even better. I agree, it's subjective, but we do believe that is a very important part of the evaluation process, and it shows who's the character of each applicant. To that character group, personal statement, letter of recommendation, we also add your research and leadership positions. So leadership positions that literally you've been a leader. I've been reading letters of recommendation or personal statement of applicants that have found groups, that have been leading groups in the community, that have been leading groups within their medical school. That's the people I'm looking for. I'm looking for those leaders. Researchers, obviously, this is like an academic center. If you have we value having some sort of experience within research, but it's not the only thing. So we give we look at it, we look at the publication specifically, and we give some kind of extra points if you want to think about that way. But in summary, I'm looking for the whole picture. I'm not looking only for fantastic grades. I'm not looking only for research. I'm not only looking for character. I'm looking for everything. And those are the stars, and those going to be kind of higher in our ranking.
That was very, very insightful list of tips on the overall selection process. Now I'm going to ask a few follow-up points on the points you mentioned, and I'll start with the clinical experience. As you said, and this is something I highlight all the time, that residency is a clinical job. At the end of the day, you might be, the best researcher ever, but you're applying for a clinical job and you need to have clinical experiences. For US students, they usually go and do away rotations. That's like the first question I want to ask you. How does that affect, if someone did the rotation at Mayo in their chances of matching? And for IMGs, do you consider any rotation, or do you prefer the elective, especially that Mayo is one of the few places that actually allow IMGs to do rotations, like elective rotations, or, some people do rotations with private practices. Do these value as much compared to the ones that are actual electives, or everything is good as long as it's a good letter?
Everything is good. Everything is good. Now, we understand that the visiting medical students at Mayo, it's also a very competitive process, right? there is an advantage when you go to any institution. I'm only talking about Mayo, but when you go to any institution and we can see you, you leave a good impression. Obviously, that's going to matter. It's not the only thing, it's not the highest thing, but it will matter. When it's going to be our own residents calling us and saying, wow, this medical student was fantastic, it is going to matter. So we look into those visiting medical students that were stars within our system. And I'm not going to lie to you, it's going to matter. But I am very careful in evaluating everybody, right? Because maybe you are a star and just couldn't get into our visiting medical student program. So we're careful with that. But does it matter? Absolutely. But I would say that it's even more important. What matters most is to have that strong letter of recommendation of somebody that have seen you to be a good clinician, right? And as a student, that's what we expect. We expect you to come to the clerkships and be strong, be a star, and do the best that you can and learn and show all this character values that we are looking for in an applicant.
That is amazing, because a lot of IMGs think about the process late, and the visiting medical student program required to be a student and do certain exams. So that's actually phenomenal to hear that you consider all rotations if somebody was performing well, because I feel like a lot of IMGs are at disadvantage because by the time they decide and they prepare everything, they already passed that point that they're eligible to do a visiting rotation. Awesome. So now I want to go and talk about the prelim. Before I go into that, I know that the dogma of general surgery, application for internationals, is that you have to do a prelim year, and then if you perform well, you either go to another year of prelim or you match to categorical surgery. However, each program has their own selection criteria. I understand that, and some programs take more IMGs directly into categorical. From my knowledge of the Mayo program, there has been instances where IMGs match directly into categorical. Can you give us an idea of what is the characteristic of that applicant that made them so good to match directly into categorical? Did they do 100% all of them did the rotation, or what was unique about this type of applicant that made them match into categorical immediately at the Mayo Clinic?
That's a great question. I get that question a lot. So I want to say, first of all, there's not a rubric. I don't have a checklist that I go through each one of them. Every international medical graduate after goes through our filtering process, or that initial process, will go directly into our preliminary list. Whether you have chosen prelim and categorical, we immediately group them through kind of a bucket immediately. Okay. Why we do that? Because we think it's a little bit more fair. It's a little bit to compare to international medical graduates to international medical graduates versus USA graduates. We do think that there's a different group based on opportunities, experience, etc. And there's good things about both groups. I'm not gonna say that one is better than the other one. No. But they're different, so we kind of group them that way. We go through exactly the same process. Both groups go exactly the same process. In our system, we ask them to, first there's a video that they have to record themselves answering a question, then eventually goes through the interview process. Is exactly the same one for both groups. And at the end of the day, we have two groups with all of this data, right? By the end of the interview process, I have letters of recommendation, personal statements, grades, that video, which at points we have the panel, right? The interview panel. We have the assessments which at Mayo do, which is an objective simulation assessment. And we look at that, and who are those that could go from preliminary to categorical? The stars, those people that were fantastic, either the same as any of the categoricals group, or sometimes even better. So it's a decision, it's a committee. It's not my decision, it's a committee. We look at the same data. And it has, in some instances, it's been medical students that have come here that we've known a little bit better. Some others is as a reference, like also, right? Like people that we know that know the system that have called us, and we have looked at that, and then this person, some of them actually have better grades than, again, the categorical group. So there's not a checklist, there's nothing specific that we look into. We simply look at the data. And when we recognize people that are above average or higher in that data, then we take a leap of faith and we offer them a categorical position. And so far, fantastic residents. I cannot say anything negative. They've been amazing. So, and I think that's true for every program. There's not a one rubric. It's just it's the same data, and with all the information that you get, and then you say this person might qualify for a categorical position, and you offer it.
Awesome. I'm very, very glad to hear that the process is that fair and that objective, and multiple people, because a lot of international graduates don't understand that this is how it works. They think that there is a certain score, and if you don't have that score, you're out, and if you have that score, you're in. It's way more complicated than that. It's not one person making the decision. It's a big committee, and there's a lot of data that you need to work on to reach where the US graduate is. And a lot of IMGs also have that mistake that by scoring high, they're like in, which is not the case. US graduates, I've seen, US students. Once I did a lot of research at Mayo and MD Anderson, and I saw that they do a lot of other things that for us as IMGs don't think that these are important or don't spend time on. So you need to build the overall application that Dr. Rivera was talking about. There is a recommendation. Who are these people? How much time you spent with them? Your personal statement, a lot of things, not just your scores. Now we talked about, directly categorical. Now I want to talk about prelim. And a lot of IMGs and sometimes even US students are afraid going into prelim. It's like a year of uncertainty. They don't want to do that. What do you say to these people about the outcomes of people who did prelim and what happened to them after?
Great. So we look into this, trying to answer that question. There's a publication, I want to say maybe 5 years ago, with myself, Dr. Farley, I can't remember if you were part of that one. I know that you've been part of some of those research projects. So there's about an 80% rate of going into a categorical position. Majority surgery, but not everybody goes to a categorical position within surgery. I thought that was a great number. The other 15 to 20% either will go to, go back to their country, or will change careers, will change specialties, etc. So I think it was a very good number for us to know that a big majority of our own preliminary residents will get into a categorical position, majority in surgery in the United States. So what do I tell people? Number one, consider your pros and cons, right? Every story is different. Every person that decides to move from their education system to a different system, in this case, we're talking coming from outside the United States to the United States, is a big change, right? And as you very well said, you have to prepare. You have to know everything that it takes. After you do that soul searching and you know what it takes and you decide to do it, then commit to it, right? Come with everything that you got. The preliminary year, it is a scary year. I haven't personally been through it, but I see my residents every single year. It's another year of going through the match. The more that you go through the match process, the least the possibilities that you will get interviews and you'll get into a categorical position. That's a fact. It's a beautiful year of growth. I can guarantee you that. That's something I see. We see it, we measure it. It's a year where you learn the system, the American system, inside and outside. It's a year where you kind of check on yourself. Is this really what I want to do? Because it's a huge change, right? From a cultural standpoint, but also from a personal standpoint, from a professional standpoint. There's so many implications. And it is tend to be, like a year where everything changes for you. I would say that it's going to be very important to find your tribe while you're going through that year. Find that group of people that are going through a similar process, that understands your process. Try to keep as, what I'm trying to say is that I have seen preliminary residents being so stressed about the year and what they're going through, and validating that it's totally normal to feel that way. You got to make sure that that stress do not interfere with your performance, right? Because acknowledging it's hard, you still have to perform. You still have to come to work, care for patients, learn how to do surgery, read for the tests, read for practice for the test that you have at your residency. So it's an extremely demanding job on its own. And then on top of that, you're adding this level of stress that the preliminary residents go through. And you have to be ready. You have to be emotionally ready for that. And find, how do you do that? Well, realizing, acknowledging, talking to people, finding that group of people that will support you during those hard times. That's going to be essential, whether it's within the residency, outside of the residency. The world is open now, right? With technology, could be closer to home, but it's gonna be hard. And the more resources that you have for you to go through this difficult period, the better it will be. Take advantage of the resources that you have at your institutions. Every institution, we care for you. We care for the preliminary residents. We know that you're going through a hard time or a difficult time. We're here for you. Ask the questions, get together, talk to your program director. The what ifs. What if I don't match? What if I go through the SOAP and I don't match? How are you going to help me afterwards? Those are very good questions to ask ahead of time, and that will ease your anxiety a little bit. Okay. I would say that the majority, I'm going to say in the last years, 5 to 10 years, around 98% will match in a spot after being a preliminary PGY1. I'm talking in our program. The majority of those spots are going to be preliminary PGY2. I know, hard. I get it. It's not easy, but you are still in the battle. You're still in the system. You're still showing up. And your PGY2 year, it's going to be better because you already know so much. You're already part of the system. You already know how this is. It might be another change. You might have to change to another program, but it's still, you know so much that what you knew before. So it's a long process. You have to be very honest with the process. You have to want to be here and want to go through this process, and you have to find the resources that will help you through the process. Did that answer that question?
These are great points, and I want to stress some of the phenomenal points you touched on. Well, the first one is the prelim year could be a year for you to actually know that this is what you want to do. And you mentioned that, and we actually asked these people who went into anesthesiology and IM and FM, and they actually said, I did not like surgery. I thought that I liked it, but once I actually did it, I didn't think that this is what I want to do. And that was a small portion, but some people change specialties. So this could be a year for, and I know actually some friends who went into the prelim process, and when I talked to them after, I was like, oh, I didn't know that it's like that. And now I've done it, I actually want to do something else. So that's a portion. Another portion decide to move back to their country, or they match, as you mentioned, into a PGY1 at Mayo, PGY1 at somewhere else, or the prelim route, which a lot of people are not familiar with. But some programs, because they expand, they open spots to research, some people drop out. You can take a spot as a PGY2, either in the same institution or somewhere else, which I've seen some people, Dr. Rivera, who match into prelim one place, PGY2 somewhere else. Sometimes even like a PGY3 prelim, and then they continue general surgery training and they become phenomenal surgeons. So don't let that, oh, I didn't match categorical, that means I'm not as good as the others. That's not true. It just takes you to be good. And as you mentioned, like amazing point you talked about is the emotional support and the emotional, well-being to go through that process, because it's a lot of stress. As you mentioned, being a surgery intern is by itself a lot of stress. So imagine the uncertainty that comes over that. And those people who succeeded with this process, I feel, are those who were able to keep it, keep a strong attitude, keep a nice attitude. Because as you said, if you don't perform well, you're not going to match. So if the stakes on you, you're not going to continue with the next step. So you have to be, emotionally very strong and able to handle those stresses. And there are people, amazing people around you who will help you and, be your tribe, as you mentioned. Now I want to talk about the interview process. So every year, and I want to talk about for both. It's the same interview that happens for both internationals, US students, and you said you rank them, separately, but it's the same process. How does the interview process look like at the Mayo Clinic? How many people interview each person? How does it work?
Perfect. So after we go through the filter, we have our first ranking. We're going to have two lists, categorical and preliminary residents that are active, right? That went through that filter of inactive versus active. And then we have so many interviews or applicants, that is so hard to get to. We typically have about 60 and 60 spots to interview, 60 for categorical, 60 for preliminary for interview. So what we do is to get to that 60 number from 400s to 60, it's hard. We ask the first 100 people, around 100 people in both groups, we send them an email and we ask them to record themselves answering one question. The question for this year was, we've changed the questions during the years, but the question for this year was, what do you think a good surgeon is? How would you describe a good surgeon? It's a very open question. We're trying to see, what do you value in a general surgeon, right? We both, myself and my Dr. Trenton Foster, which is the Associate Program Director for Recruitment specifically, he and I both we divide the videos and we have the ranking, we score the videos, exactly the same one for both groups. From there, with the help of the videos, then we go to that 60 number, 60 and 60. We have 2 interview days total. This year is one in December, one in January. It's going to be either December, January. That's typically have been our dates. So we invite, this year, we're going to follow exactly what the Association of Program Directors recommended, which is invite after October 26th or after. So between October 26th and October 30th, we're going to be inviting the applicants, for the interview. We're going to only invite 60. Okay, we're not going to invite more, so it's not a race. And we changed that because it wasn't fair to be people having this anxiety of, if I don't answer immediately, I'm going to lose my spot, right? That's how typically we did it. All programs did it. That's not the case anymore. At least for us, it's not. We invite exactly the number of spots that we have, and we give each person 48 hours to answer us back. If in 48 hours you say yes, that's a guarantee that you're going to have an interview with us. If in those 48 hours you answer no, then obviously, then we will invite somebody else. Then we'll invite 61, 62, while we go through our list, our ranking list. Same deal. We give those 48 hours every time that we are sending an invitation. If you do not answer within 48 hours, then we're going to assume that you're not interested in our program, which is fine. People change. And then we're extended to the next person. So to be very, very honest, right? And we will inform you within that email that you had that time frame to let us know. Why 48 hours? Again, trying to make it as less stress as possible. We understand it's a very stressful time, the application time, so we want to ease it a little bit. And maybe you're in a rotation, maybe you're in the OR, maybe you're traveling. We think 2 days is a little bit better than 6 hours, 12 hours, or anything like that. Okay. Now, once you say yes to our application, we send you what we call an interview package by email, no matter where in the world you are. We have sent package to Russia, we have sent package to Russia, we have sent package to Europe, anywhere in the world. And that package contains a needle holder, tissue forceps, ligatures for practice, a skin pad, multiple resources for you to practice. Why we do that? Because the day of the interview, there is a section of the interview that is simulation assessments. So what are we assessing? We are assessing anatomy knowledge, and I send you a full list of anatomy structures, anatomical structures. And there's going to be an image, an illustration. It's not in the OR footage or anything, it's an illustration. There's going to be an arrow, it's going to be very clear, and you have to name that structure. We gave you the list of the structures that we include. Okay, so review your anatomy knowledge. That's it. That's what you have to do. All medical schools around the world, you had to learn anatomy, right? They are anatomical structures that I have identified that are extremely important for you to know before you start residency. Okay. We measure emotional intelligence. So how do we do that? First of all, and I didn't clarify this, our interview this year will be virtual. Will continue to be virtual. What I'm going to do next year, I don't know yet, but this year I know for sure it's going to be virtual. Okay. So the second that I mentioned is this emotional intelligence. Basically, we have a standardized patient, and we're going to get you into a uncomfortable situation that you might encounter as a medical student. And we want you to navigate through that difficult situation. It's stressful. Yes, it is stressful. So we are expecting that in your career, in your profession, you have learned how to manage those difficult situations. And we want to see you doing that. And the more that you get into that role, we're measuring empathy, compassion, because everybody wants a compassionate doctor. I'm sorry, but at least that's what I want in my residency. Compassionate doctors, right? Day one. Another skill that we measure is how do you apply information that you've learned. Specifically, is everybody should have learned how to read a chest x-ray, basic chest x-ray. That's gonna be very basic radiology concept knowledge. Most people during medical school have some sort of interactions or exposure to trauma patients. So we tell them, you have a trauma patient to the chest, trauma chest injury. Look at a chest x-ray. Tell me what you see in those chest x-rays. And that's integration of knowledge, right? You learn two different things and now you put it together, because at the end of the day, that's what you're going to do in residency. You're going to put in a lot of information that you learn in medical school, and you have to put it all together and come up with a clinical judgment, with a plan, with a treatment, etc. We're measuring also your knowledge regarding reading or interpretation of arterial blood gas. And then the last one is about communication. So that one, it's a very interesting one. We're gonna put up an image, which is a Lego model built by Legos, and you have to use your words to tell another person, only with your words, to that person build that model that you have in front of you. That person is blinded to your model. They only see their pieces right in front of you. You know what pieces that person have, and then you have to use your words to instruct that builder to build that model. Well, we've learned so much from that station. In fact, in the interview package, we send you an index card with the language. So because we don't want to assume that everybody knows what a Lego is, that everybody have played with Legos. We take care in that the colors that we use are appropriate for that everybody can see those colors. Because not everybody see all the spectrum of colors. So we take in consideration many variables to make it as fair as possible. And then in that same time, in that same test, you also meet with the program director. This year will be me, and you'll have a one-to-one. So that's why we send you a package before, because we're going to be assessing you the day of the interview. We also have the standard panel interview. In our program, it's going to be 2 persons in that interview panel, and you're going to have 2 of those interview panels, so a total of 4 people, but in 2 different sections. In each interview panel, there's going to be a faculty member. It's going to be a faculty paired or faculty and resident paired. Okay. We have a very complex process, and we blind those faculty from a lot of information from the applicant, so that we are very intentional what we want out of that interview panel. We want them to meet them and trying to remove as much bias as possible. So I'm not going to be very detailed what are we doing this year, because we're changing a little bit what we did last year, and actually I'm having these meetings coming up soon. But we will let the applicant know exactly the information that we gave the faculty, so that they are aware, and the same vice versa. So and the only reason we're doing that is because we're trying to minimize as much bias as possible from the interview panel, because we're all humans, we all have biases, right? It's not going to be 0, but we have to address it, and we have to call it out loud, and we have to try to minimize this as much as possible. The other 2 parts of the interview day are going to be a time with the residents. They recorded themselves walking around campus. They'll show what campus is about. It's a video, but it's a video that they are talking through the video live. So it's not just a video play and you just watch it. It's a complete interaction. They stop the video, they ask questions, they go back, they go forward, etc. And it's an only resident. There's no faculty there, so that applicants can freely ask any questions that they want. Last but not least is going to be the technical part. Because of the reality of the virtual world, it's very hard to assess technical skills live. So what we ask you is, with those instruments and with material that we send you for the actual test, we're going to give you a list of skills that we want you to record yourself doing, and then upload that video. We'll give you time during the interview day to record a video and load them. And we give you, there's going to be an IT person that's going to help with any IT issues of uploading the video. So very complex interview. Why we do that is because we're trying to add more and more data. I'm going to tell you, the quality of the applicant is amazing. The number of fantastic applicants. I witnessed this process for the first year, the whole process for the first year this year, and I was impressed with the quality at all levels, grades, but also character, research, everything, both from the international medical writers, from the categorical. So at the end of the day, what we're trying to do is get more data that is as objective as possible, less subjective, and give you a chance to show, who you are. You might be extremely intelligent in some areas. You might be very emotional intelligent, and maybe your grades or your knowledge is not as good, but we're trying to balance all of that information the best that we can to get the full picture. That's what we're trying to do. We want to get the full picture of each one of these applicants to really do an informed decision at the end of the day of the ranking.
Wow, that is indeed like a very complex process. And, I see a lot of programs, they interview applicants, they talk to them, and boom, they're done. But and honestly, I've been thinking about this a lot. We, prepare people to go through med school. We test them about like a lot of medicine stuff. We interview them and talk about why do you want to practice specialty and, things that they can prepare. But we never test their surgical skills. We never test their judgment, their emotional intelligence. And I'm very happy to hear that your program does test people and what they will be actually performing during the job.
Yes.
It should be like that. Somebody going to surgery, they don't get tested on surgical, basic surgical skills, just to make sure that they actually can do these basic stuff. And you're making it very fair. You're already telling them that this is what we'll be testing you on. So just
And,
prepare.
and not only telling them, we do have using a program called MySpace, we upload videos, educational videos. You can remember Dr. Farley had a lot of educational videos. We include some of those. So we give that resource, because that's another thing, right? I cannot assume everybody teaches the same way or the same skills, or they have the same exposure to those technical skills. So I don't know if you're, I think I'm testing more motivation, right? If you're motivated, if you want to learn, if you can learn using a video, if you want to take the time, I'm giving you everything. I'm giving you the tools. I'm giving you the video. Take advantage of it. Even if you don't apply, if you don't rank at the Mayo Clinic, you still, I want to feel that you learn something going through the process of the application and going through the process of the interviews at Mayo. At the end of the day, that's what I want. I want those 120 applicants to have learned something, to be better at the end of that process.
Definitely, and these skills will help them anywhere they go. Surgery,
Anywhere.
or like plastic surgery, orthopedic surgery, these skills are like basic skills every surgery.
Basic, very basic, correct.
And number two, I agree with you, because residency is all about motivation. No resident comes and knows how to do laparoscopic surgery or robotic surgery. Every program has these resources, have these rooms that most residents don't even go to practice. If the resident has the motivation to learn, everything's available. So this is what it takes to be a successful resident, the motivation.
And video-based learning is here to stay, right? Exactly. You guys have the world in videos in front of you. Wherever you go, you open YouTube, you can learn anything, right? 100%. So video-based learning is essential, and that's exactly what I'm doing. I'm giving you a video, I'm giving you the tools, and I say, hey, go ahead and learn, because I'm going to ask you later about this test. So if you do that, you will be a better candidate at the end of the application process.
So now that you collected all this data, how much matters? I get this question a lot. The pre-interview, like scores, research, all these things we talked about, and these data that you collected during the interview, is it like all these data points come together, or now that you got an interview, what matters is the interview, and we don't care too much about your prior stuff like research and scores and grades?
Everything matters, but I'm going to tell you something. By the end that we are in that interview process, all that pre-data looks so equal, so similar. Everybody has similar grades, similar letters of recommendation, similar personal statements. So I would say that in reality, even though we look at everything, in reality, what's going to get them out and get them into going from 60 to 10 from prelims and 11 for categoricals, which is our positions next year, it's going to be that interview day data. That's what's going to help us select. Because all that other data, even though we look at it, it's so similar for everybody.
I see. What about any few tips on the session between these two faculty that you mentioned, on like tips on answering residency interview questions, what people should keep in mind to shine during that part when they're talking to a faculty or a resident?
Yes, excellent question. First of all, practice. It's going to be virtual, so my recommendation will be to practice virtual and actually record yourself. And as painful as it is to see yourself again, look at yourself again. Are you looking at the camera? Are you looking up? Are you looking down? Check your settings, right? Everything around you, it's telling a story. Okay, so I have I'm in my house right now, so I have this painting in the back. I see people with all white. That's fine. Whatever it is, you're telling a story, and be ready to maybe answer. Maybe somebody will ask about the painting, or maybe someone will ask about a picture that you have there. It's okay. It's whatever you feel comfortable, but keep in mind that you're setting an environment, you're setting a story with everything around you. And those are things that we don't think about until we see it, right? So that's the first thing. The second thing is, in the virtual world, how we express ourselves is kind of zoomed compared to in real life. So it is good to see how do you see yourself, right? To look at yourself and maybe, make sure that you're feeling comfortable, that you're everything around you, that you feel very in control of that video, of your environment. That's going to be a recommendation that I'll make to everybody. Number 2, be yourself. That's the number one thing. Okay, everybody's going to ask similar questions where there's going to be structured questions. There's going to be some emotional intelligence questions. They'll put you in a difficult situation. What would you do? Number one mistake I see is that people are just thinking, what does she want me to say? What does she want me to say? And then what comes out is fake. Be yourself, right? In this situation, pause, breathe in, take a big deep breath, and think, okay, what would I do? What I would really do in this situation? And answer that question with honesty. Be prepared. You wanted to come to Mayo. You wanted to go to this other program. You selected us first, right? That means that you need to know us. Go to the website. Learn who we are. As much as information. Have a few questions prepared. You should have a reason of why you want to come to Mayo in this case, or you want to go to other programs. There should be a why. Those questions should represent that why. Example, let's say that you are interested in doing research. You know already that Mayo, it's a very academic, heavy center. We have all ton of research availability. Maybe your question is about how do I select, or how do we select the residents that will go into a 2-year program of research? Or maybe the question is about what are the opportunities for research for residents, and at what level in that process. That shows me that you are interested in research. But I only want to hear that if you're actually interested in research, okay? Same for community practice. Same, Mayo, there's so many opportunities here in Mayo. But you need to know the why, and you need to know the program. And then you need to be yourself. Again, as the interview process are getting more complex, read with the information that you get from each program. Expect from Mayo that we're going to tell you exactly what your faculty, as I mentioned before, will receive from you. Don't assume. Don't assume everybody received the CV. Don't assume everybody received your personal statement. Don't assume that, because the processes, and I think appropriately, we're all making changes, trying to make it more fair and less biased. So don't make assumptions. Prepare. If you get the names of the faculty that are interviewing you, sure, do a quick search, see who they are. I don't think that that's a complete expectation, but if you want to do that, then you can ask a question. But if you're going to ask a question about my research, for example, make sure that you got the right M. Rivera. Right? So be careful with that a little bit, right? Do the good job. But I think most than anything is be yourself. The interview process goes in 2 directions. It is for me or for us to get to know you, and it's for you to get to know the program. So that it be very intentional, and prepare for that. Prepare for us to get to know you as who you are, and prepare for you to get to know the program as much as you need, so that at the end you're making it's an informed consent. It's an informed decision making.
Indeed. Awesome. That was very, very insightful. My final question is, for those who match into Prelim, what factors do they need to do, or things that they need to do to match into Categorical at Mayo? Or what makes a Prelim unique to be considered for the Categorical next year?
Excellent question. It's going to be very similar to what I have said already. It's going to restart all over again, right? Is that whole person. Is not just one thing. And Mayo, so let's go from objective to subjective data, right? Yes, do we take in consideration your objective data as an upside score? Absolutely. We also have internal assessment, as you mentioned at the introduction. What is that? Is we give you a test. The first week of residency is a technical and non-technical skills test using simulation. And we don't expect anybody to pass that test. What we expect you to learn is what you know and what you don't know. And then we're going to give you resources of where can you learn the different skills. And then we're going to repeat that test around 5 months later. What are we looking for? We're looking for improvements. Oh, you had no idea how to tie a knot? Perfect. We gave you multiple education tying knots. We gave you exposure in the OR. We gave you a video for you to learn. We gave you material for you to practice, right? Show me that you were able and capable of learning through that process, and you are able to self-educate yourself too, right? And at the end of the day, we'll give you exactly the same test, and you can see how much you've learned. We're going to use that data for preliminary residents. Absolutely. That's objective data of how much that those residents are able to learn through those 5 months with the resources provided. That's going to be kind of our objective data. And then there's going to be the subjective data. And again, there's a common theme here. And that's going to be the evaluations, right? There's going to be the day-to-day evaluations of the faculty, evaluation of the residents, evaluation of your nurses, of all that group and team that is working with you. And it's saying who you are as a physician. You can be super nice with me, the faculty. That's a very common mistake. They're very nice with the faculty, very nice with the residents, and they don't treat well our nursing staff or respiratory members. Those are essential team members. And I'm looking for that person that can be a good person with everybody, right? So that evaluation, those who tells me who you are as a clinician, as a physician, it's going to be essential. So it's not only knowledge, but also your day-to-day. You're going to be competing among your peers, right? So believe me, every year is so hard to select. We at Mayo will traditionally have match or keep between 1 to 2 preliminary residents. And I wish I could keep more, but obviously I can't. But the idea is that we take that person, it's a whole package that thrive, that we already can see that they can thrive within our system, and emotional intelligent, emotional with emotional agility as well, right? That they can be flexible to situations, that they can learn. Does that mean that they have to be perfect? Perfection does not exist. That's the number one error. What I want to see is people learning from their mistakes, owning their mistakes, right? I made this mistake, and Dr. Rivera, I reflected on it, and I've learned, and these are the things I'm going to do not to make this mistake again. That's what I want to see. That's what we all want to see. So they only compete among themselves. They don't compete outside of other prelim residents. We keep 1 or 2. And what we're looking is the same thing we were looking from your first question. We're looking for that whole resident that'll thrive on every level, and will thrive within our culture and our system.
Awesome. Dr. Rivera, that was a very insightful interview. Thank you so much for your time. Any final thoughts or advice for people watching this video to wrap things up?
Excellent. Yes. So if you're outside of if you didn't apply this year, for example, and you're preparing to apply, hopefully you're listening in preparation for, I think the number one thing is to look at those due dates right away. As you said, many programs will have different due dates. Areas will have their own due dates. Also, if you're going to do a visiting medical student opportunity, it sometimes takes a year to 6 months to apply ahead of time. You have to apply ahead of time. So look at those due dates and start planning, as you very well said. Take advantage of all the resources around you, whether you're within the United States or outside of the United States. Resources are there. Work with people that will pay attention to you, that will help you grow, and then can write a good letter of recommendation, no matter where you are in the world, but can write a good letter of recommendation of how you are as a clinician. As a student, you are showing who you are going to be as a clinician, and that's a mindset. The medical students, they tend to feel, right, they're in this transition from college where you're just being taught, you're not performing. But that the medical school is a transition from college to residency where you're constantly performing, you're constantly taking care of a patient. So take those years of the medical student and put yourself in that situation. Take care of a patient, write a note, present a case, and get feedback and improve. But I think that you have to be very intentional wherever you are in the world. It doesn't have to be within the medical system. You're going to have those opportunities everywhere you go. So it's on you to take advantage of that opportunity and learn and be ready for residency. That's what you're doing. You're getting ready for residency, whatever residency it is. But don't be a passive learner, be an active learner, and be intentional what you want to learn during those. Traditionally, it's about 2 years of that clinical experience. More medical schools are opening those opportunities earlier, which I think is a fantastic idea. But you can go through all of those experiences and be passive and not learn anything and not be ready. Oh. So I think that's one thing I want to put in the brains of every single medical student that is going to apply to a residency, whatever residency is. Take advantage of those clinical years in medical school and make it very intentional and learn, because that's your only 2 years to prepare, 2+ years to prepare for the actual residency, and residency is hard. And then if you are going through the current process, stay true to yourself. Don't change during this process. Don't try to change for who we want you to be. You're going to make that up, right? Be you. We see it. We see people as they are. And remember, the interviews are meant for you to learn about the programs and vice versa. As I mentioned, that's extremely important. It is not a one-way thing. And if you come to an interview at Mayo Clinic and you go through this very complex interview and you hated being assessed, guess what? You're going to be assessed multiple times during this residency. Maybe this is not the residency for you. That's okay. I say that it's a marriage, right? I'm married to a man that I love, and I think he's fantastic, but he's not the one for everybody, right? It's the same thing. Residency, it goes both ways. You have to find the one that matches for you and vice versa. So, and then from the preliminary residence, I admire you for what you're doing. It is not easy. We see you. We acknowledge all the stress that you're going through. And we as programs, we're here for you too. We totally can feel your stress and take advantage of the resources in each one of the programs. And wow, I really admire how brave you are in this process, and go through it the best that you can, get the best out of it. And everything happens in life for a reason. And even if you go through the process and you don't get the outcomes that you expected starting with, I guarantee you you'll be a better clinician no matter what. And whatever you become a clinician, a surgeon, hopefully you'll be a better one after going through this process. I think that I haven't done any study to say that, but that's a feeling that I have, that just because you're putting yourself in such a stressful and difficult situation, you will come out of it better.
And that brings us to the end of this interview. Thank you so much, Dr. Rivera, for this extremely insightful interview. For our viewers, if you need any help with your personal statement, ERA CV, interview preparation, make sure to check out the Match Guy services, and I'll leave the links for that in the description below. Also, if you're applying this cycle, make sure to take advantage of our interview preparation services. We have phenomenal advisors from top-notch institutions, and I trust them so much that I made the interview preparation packages for us 100% satisfaction guarantee, which means if you're not satisfied after the first hour, we give you your money back. And you can check the great experience of prior students who worked with us and subsequently matched into residency on the Match Guy Trustpilot account, and I'll leave the link for that in the description below as well. And now it's time to share with you the 2 free guides I promised you at the beginning of this video to help you ace your residency interview. The first is a full comprehensive guide that helps you learn about all aspects of the residency interview process, and the second is a sample of residency interview questions and answers written by a resident. If you find any value in this video, make sure to hit the like button, subscribe to the channel, channel and share this video with your colleagues so they can learn more about the process of matching into the US. Before you leave, make sure to check out the interview preparation tutorial that I recorded recently, and you can check it out by clicking here or the link in the description below. Thank you everyone so much for watching, and good luck on your match.